Good afternoon. Today's topic is premature births. A baby born before 37 weeks of pregnancy is considered premature. There are nearly 500,000 babies born prematurely each year. Advances in neonatal intensive cares have significantly improved the survival rates of premature infants in the past 2 decades. Modern medical technology has continued to push back the limits of mortality, resulting in more aggressive interventions so that infants as young as 23 weeks gestation with weights as low as 500 grams may now survive. At 24 weeks, the survival rate is 50 to 90%. At 30 weeks, survival is almost certain. There are many different causes for premature births, which include stress, poor prenatal care, and substance abuse. Disorders related to prematurity and low birth weight cause in children 15.7% of deaths for these children less than a year old. Prematurity may cause long-term developmental issues including health concerns, cognitive delays, and behavioral issues. Health concerns in the physical development are related to fine motor skills as well as immature lung development that causes conditions such as asthma and bronchopulmonary dysplasia. Neurological concerns related to cerebral palsy, autism, and in digestive and intestinal issues such as Crohn's disease are all related to premature births. They also are finding physical development issues in dental, hearing, as well as vision. From a cognitive standpoint, learning disabilities have been associated with premature births. Lower IQ scores of 1 to 2 standard deviations from a full-term birth. Also, it has been shown that special educational assistance are needed in premature children. Behavioral issues are a much greater concern for premature babies. ADHD has been associated with prematurity, but on the larger scale, this is shown to be due to the early triad time between mother and child being separated due to the child being in an incubator for a substantial period of time, which creates an attachment issue. Data that documents the outcome of these infants also implies that many more infants that are premature remain in hospital for long periods than ever before. Prolonged hospital care intrudes upon maternal interaction and mother-infant bonding, where interactions take place in a newborn intensive care unit, often separating mother and their infant for long periods of time, resulting in limited opportunities for mothers to feed and nurture their premature infant. Given these delays in early maternal bonding, it is reasonable to suggest that an insecure attachment will thus be the outcome, which also calls for a longer bonding period once the child is brought home. From a spiritual perspective, faith is not in a vacuum. Faith is not something that is microwavable, and what actually is, faith is like a crock pot. It's a lifelong journey. So the spiritual development of a premature child there should be no issues, because like I'm saying, that is a life journey. As said in 1 Peter 2:2, like newborn babies crave pure spiritual milk, so that by it they may grow up in His salvation. Premature births happen in this country every day. But with the premature births, science and medical technology has improved so that the outcomes of premature births have become less. Thank you.